Okay. Okay, so sorry, I'm trying to find the questions for what we're supposed to talk about. I swear my animals are completely drawn to Google Hangouts because every time I start a video chat, one of them comes and bugs me. Usually it's my dog, but he's in his crate. Now it's my cat. Okay. Okay, so do we want to just each answer a question? Like what our responses were, and then just go through the questions. Did you guys want to do that, or do you want to each just answer our own set of questions and go person to person?
I think it's probably going to make more sense if we go person to person.
Okay, we can do that.
I mean, just I think.
Mm-hmm. Okay, works for me.
Okay, I'll start if you want, if that works.
Sure.
What led you to get involved with the organization? I did mine on at Bauer Family Resources. That's where I'm doing my internship. So, what led you to get involved with Bauer Family Resources in the first place? Most of the people that I talk to about it, they're there to be advocates for families. It's let me explain what it is. I work in home-based family services, so everybody that works there works with families who have I think I've told you guys this before, but work with people who have cases with DCS, whether their kids are taken away or not. Most of them are taken away in foster care, and the parents are working their way to get them back. So most of the time, like my supervisor and all them got involved because they wanted to help families be reunited and help parents get their lives back on track, like get rid of drugs and stuff in their life.
Mm-hmm.
What do you see are the most prevalent problems for families here in the community? I just kind of talked to everybody about it. So the responses from everybody there, very similar with the people that we work with. A lot of the biggest problem we see is a loop in the system that you get somebody who is in a DCS case and they have a case manager who is helping them get food stamps and Medicaid and helping them transport them to getting a job and helping them find a house to live, just things like that they learn they get kind of dependent on that advocate because they help so much. And then especially with a child in the foster care system, if you're a child in the foster care system, that's what they see and that's what they know. So just the kind of, you hear about it all the time, how the foster system, like it's broken because it's just the never ending cycle. And it's just because people learn to have that they can have somebody in the system that's trusting. So like as a case manager, they trust that case manager to help them and get them on their feet. So that's probably the biggest problem with the people that we see. And then obviously drugs, and a huge one that I have seen personally, everybody I work with is single moms. Most of them get pregnant out of wedlock and they're baby daddy. I know that's probably a horrible term, but that's what we call them at work. It's like baby daddy is not in the picture. And so they just don't, anyway, they don't have the means to take care of their child. It's really sad. How does Bauer Family Resources help children and families locally? There's lots of different things that they do. They have a youth system, so they have after school programs and summer programs, and this is a lot of people who are like just finishing high school or like us and in school. They work for them and they are kind of like role models for these kids. And then we have preschool and we have Head Start, so that kids who don't have the income to go to preschool, they can get free education and daycare. And then we allow for child care vouchers to be taken there. So people who can't afford daycare but need to work, they can take in their child care vouchers and get their kid babysat for free so they can go to work. And then also we have home-based family services, and there's two different sides. There's my side where we go in after the family has already been, it's called intervention, and we intervene with the family, try to get them off drugs, get them back in their house. And then there's prevention, and these people are like on the brink of losing their children, and they're actually the ones that come to us for help. And intervention DCS comes to us for help and says, hey, this person needs help. You need to do this and this and this with them before they get their kid back. And prevention, the people are coming and saying, hey, you know, I can't pay my rent. I've got bed bugs. I need some help. And so that's the difference. That's how they help. Do you feel your organization is child or family focused? In other words, does your organization strive to strengthen the family or to step in to help children where families are failing? We do both. In my particular department, we do both a lot. It really depends on how well the parent is doing. If the parent is acting like they don't want their kid back, then we have to start looking at the needs of the child. So in any DCS case, you have 22 months. If you have your child taken away, you have 22 months to get your life back together. After 18 months, they do it's called a TPR hearing, and it's terminated of parental rights. So before that 18-month mark, we kind of, just before, we have what's called a case staffing, and we talk about the case, figure out what we can do to help the family, or in general, we just think, okay, is this parent going to get better in the time that the child needs? Because at that point, like 22 months, that's 2 years. It's a really long time for a child, especially a little one. Is it better for them to be in foster care, foster to adopt, or is it better for them to be back with their parent? And it just depends on the parent. So we're family focused. We're more child focused, but we're family focused when we need to be. But for the most part, we really look out for the children because we want to end the cycle. And I didn't ask 2 questions from the chapter. So those were my questions.
Cool. That's really neat.
Yeah, it's interesting.
I can go next.
Okay.
So I chose to interview the Family Crisis Center. I also did my internship there over this past summer. And so for the first question, basically the head producer or director said that domestic violence and sexual assault are an issue in all different socioeconomic groups and nationalities. And so it affects people from all over the place. And it affects individuals as well as families, and people of all ages as well, like from adults to also young children who are experiencing abuse in their home. Mm-hmm. And she wanted to be in a position where she could help intervene in cases of abuse when they occur. And the facility also offers services such as a thrift store downstairs and a food bank, which helps to provide for some of the practical, temporal needs of the families that are struggling. The next question was, what do you see are the most prevalent problems for families here in the community? And she said that domestic violence is pretty prevalent because it occurs often in young couples between the ages of 18 and 24. And so that's kind of a lot of people in the Rexburg area tend to be BYU, Idaho. And so it's kind of common at that stage of life or at that age. And so it's from the university sometimes and just the community in general. And it's often kind of an embarrassing subject to bring up to someone that you need help with. It's kind of a little bit embarrassing. They're shy to admit there's a problem. So that's something that occurs in the area, she said. And then as far as the food bank and thrift store, a lot of families can't afford to buy food all the time to supply for their kids' needs and everything. And so they'll use the food bank every week to come and get a food box And I used to volunteer there as well. And they'll like let you write your household number, like 5 people, for example, on the box, and then they fill it according to that number of people that need to be fed. And they have really inexpensive clothing and household goods in the thrift store as well. So that helps families to just meet their temporal needs in a way that they are able to for not much money. And then the next question, how does the organization help children and families locally? They do lots of things, like I mentioned, the thrift store and the food bank. It's open to the clients, obviously, as well as just the public can come and get a food box once a week. They just have to be a resident of Madison County. And they also help clients with the legal processes if there is an issue with figuring out custody of a child or figuring out divorce proceedings. So they'll help the clients kind of work through the legal processes and understand those things. And they offer free counseling sessions to the public. They have a Spanish group and also English. And they have children's support groups as part of that. Like you can bring your kids with you and they'll have a separate class they'll go to for a support group. And so I've been to a few of those and they're pretty interesting, pretty helpful, I think, for the clients that go. And there are also caseworkers that work with clients individually and help them to understand what services can be provided through the Family Crisis Center and how they can find assistance there. The next question, I'd say that it's both family and child focused. There are some situations where children are experiencing abuse, and so they'll have like forensic interviews where the police come and they'll observe from like a different room. So there's a camera and they'll be watching in a different room. And so the children will explain the situation and they'll help the kids to kind of cope with it and understand a little bit better. But mostly they deal with adults and helping them to work through cases of domestic violence or abuse. And so in a sense, because it is focused on situations like that, it does help the whole family, because if there's a problem, they help to obviously eradicate that and solve it, so there's no more danger in the home. And that about covers what I got as far as information for my organization. So
Good job. Okay. The person that I chose to interview is the director of our public health department here in our county.
Mhm.
And I asked her what led her to get involved with the public health, Kern County Public Health, in the first place. And she said that she got involved because they do different things. They help people from birth to the grave. They have different services for all ages. And she also wanted to be involved in the maternal child health with women and children, the trends and policies and the education to improve those. And then what do you see are the most prevalent problems for families here in the community? She said the number one problem that our county has is substance abuse. She says because of substance abuse, it makes people unable to provide the basic needs for their family and children. And so they get, because of the substance abuse, they get off track and their basic needs aren't met. And then they don't have health insurance and they don't have housing, and it causes homelessness. And so their agency works to link them to other agencies where they can get assistance so they can overcome their drug abuse and, provide housing and, get back on their feet that way. And then how does Kern County Public Health help children and families locally? She says they have public nurses that go out. They have a program that if they get a referral from like a hospital or a doctor's office of a high risk pregnancy, they go in and they intervene and they meet with that mom and provide services and kind of track that, and so that they can have a healthy delivery, and then they follow those kids until they're, like, I think she said 8 years old, and they connect them to services and like make sure that they meet their appointments that they need to, newborn appointments and stuff like that after the baby's born, and get their immunizations and stuff like that. And then they also have the California Children's Services, and that's for kids that are born with chronic conditions, and it links them to services and provides funding that insurance doesn't always cover and keep. And then, do you feel your organization is child or family focused? In other words, does your organization strive to strengthen the family or step in and help where families are failing? She said yes, that in every walk of life, from, birth to death, they have, places that they can help people, send them, link them to an agency and then a couple of the questions that I asked her was, what can a community member do to help solve issues? And I asked her if they had like volunteer opportunities or community involvement. And she said the main thing is to do in the community is to get involved, to do something about it rather than just complaining about it. And she related an experience about, it actually was a family that was in our ward at one time, and they lived in a really bad neighborhood. It was just, there was drive-by shootings. They lived by a park that was just full of drug abuse and just all kinds of just horrible things. And this family didn't have a lot of money. There's no way they could move out of that neighborhood. Mm-hmm. And so the mom contacted this agency, and she actually like took the neighborhood back, where she formed like a community where service project where they went and cleaned up the park and provided like activities in the park, like family activities and stuff, and it totally transformed the neighborhood and cleaned up the park. And then I asked her about like funding issues, because all these programs always take funding. And she said that that every year they have to decide everything they do is like best practices, evidence-based, and what and research-based, and that the data is critical to see results, and that's how they base their funding and what programs they do away with and what ones they keep. And they also have like a community wellness and a disease control and lots of other things. And that was about it.
Cool. That's awesome. Are we supposed to do something else, or is that it?
I think that was it. I just think we need to come up with an idea that we want to do our Facebook page on.
That's a good idea. We do need to do that.
I mean, I don't know if you need to tape it. I don't know if you want to turn off the.
Yeah, we can turn it off. I'll turn it off.
I mean, it doesn't matter.